Alright guys, we are back. We left off with, we had just started thigh and hip rehab techniques. We talked about general body conditioning, we talked about flexibility. And so now, I'm going to start showing you some of the exercises. So these are a bunch of different flexibility exercises. We'll just start up at the top here. We have, you can do this either passively or actively, so you could have a clinician here pushing the foot, or you could be, this person herself could be doing it by actively bringing her hip into flexion. Okay, so right here we're going into hip flexion, which is going to stretch. What we're mainly isolating here is the hamstrings. And if we were to point the toe down towards her, we would get even more calf and hamstring stretch. But we're also secondarily getting some glute stretching as well. So as she goes into hip flexion like that, with the knee extended, she'll get hamstrings and a little bit of glute. Okay. Just want to contrast that with picture E right here. Same thing, she's going into hip flexion. Again, she could have a clinician here pushing her knee towards her chest, or like you can see in the picture, she's using her hands to pull the knee towards her chest. But again, this is hip flexion. The difference is with the knee bent here, we're really going to isolate the glutes. And with the knee extended here, we're really going to isolate the hamstring. Okay. Picture B, we have two things going on here. We have knee flexion, which is going to put all the quadricep muscles on stretch. Okay, and then she, with one knee down and one knee up, she's going to lunge forward, and that's going to give her a hip flexor stretch right there in the front of her hip. Okay, so the reason that we like to combine these two, I mean, certainly we could do them separately, but combining them, if we remember the anatomy of the rectus femoris, it crosses both the hip joint and the knee joint. So if we only do one or the other separately, then the rectus femoris never really gets a good stretch. However, if we combine these both together, then the rectus femoris really gets put on stretch, as well as the other hip flexors and knee extensors. So we get all four quads here. We get the psoas and the rec fem here, and we get the rec fem in the quad. So important to try and do them both together. Here in picture C, where she is stretching her hip abductors. Okay, so by pulling the knee up towards her chest and then across her body, we can stretch all of those abductors and external rotators. Okay, so we're getting glutes here, mainly glute medius and glute max. But we're also getting that piriformis muscle that we talked about. So it's going to definitely stretch all of those muscles, but isolate those two glute muscles in that piriformis. Okay, something else to think about with this one too. Those muscles feed into the IT band, right? Glute muscles, it's going to stretch a little bit of the TFL, but those are going to feed into that IT band. The IT band is just connective tissue, it's not actually a muscle. So we can't stretch the IT band, but we can stretch the muscles that go into the IT band to help relax it. Okay, then in picture D here, this is another way to try to relax the IT band. She's brought this foot across into adduction, which is going to put all of those lateral hip muscles, so the TFL, the glute med, a little bit of the glute max, those are all going to be on stretch here. And then she's doing a side bend to get even more of a stretch. And so those will definitely stretch and help alleviate tension on that IT band as well. So this is both a hip stretch, C and D are both a hip stretch, but also help alleviate that tension on the IT band all the way down the thigh. And we already talked about E, F here is just an active range of motion exercise. Okay, all these other ones have been passive range of motion. And the nice thing about this is it's a good progression as like a dynamic warm-up before you are getting ready to do, whether it's practice or a game, or in the rehab setting before you're doing more functional type exercise, plyometric exercise, return to play type stuff. So she's just swinging her leg into hip extension and hip flexion back and forth. Good active range of motion exercise. Picture G here, we're doing a groin stretch. I think we all know the butterfly. We can do this actively or passively. Okay, so in this picture, it looks like she's doing it passively. It looks like she's putting her elbows onto her knees and pressing down with her elbows, which will passively stretch the groin and adductors. However, you could have a clinician here also pushing down on the knees. That would also be a passive stretch. And then the other thing that you could do is, instead of using your elbows or having a clinician come, she could actively press her knees towards the table or the floor that she's on, which would activate her external rotators and her abductors and still stretch the adductors. So that would be an active range of motion stretch, right, where she's actively engaging the external rotators to stretch the internal rotators. Okay. Here, this is a clinician helping her with some internal-external rotation. Okay, if she holds the knee still and that becomes like a pivot point, she can pivot the foot out or in, and as she does that, that's going to rotate the hip. Okay, so by bringing the heel in, she can get external rotation of the hip. By rotating the foot out, she can get internal rotation of the hip. It's another passive exercise that the clinician is doing for her here. Something that we didn't talk about as much with the upper body, but is definitely still important, is foam rolling, right? So anytime we're trying to loosen up and increase flexibility, decrease tension spots and fascial adhesions during that early range of motion or even late range of motion phase of rehab, we can use foam rolling, which it looks like she's using here, to roll out all the hip muscles. Or in picture K here, it looks like she's using some sort of ball to roll out the glute muscles. Okay, so we can use a ball, we can use a foam roll. Important to note that we didn't talk about these with the upper body because it's less common and definitely hard to foam roll upper body. But we could still use a tennis ball or a lacrosse ball, in the shoulder or the forearm for sure. Just more common with the lower body. Okay, so we could foam roll as part of our range of motion phase. We could use a ball as part of our range of motion phase. In J and L here, these two pictures, they're just trying to show you that you could use there's just different ways that you can do these stretches. Here she's doing a single leg balance and then reaching for her toes, so stretching her hamstrings. And then this is just here as additional support for her balance purposes. Certainly you could just stand next to a wall, or you could use a PVC pipe. Or if your balance is good enough, you can just do a single leg RDL where you're just on one leg and the other leg goes back as you reach down towards the toes. And then in picture L here, he's sitting on the Swiss ball and leaning forward to get a hamstring stretch. However, you could do this on the side of a chair or a bench or something like that as well. Okay, so just showing you that there's different options. You can be creative with how you get this flexibility and get these stretches in. Different mobilization techniques can be necessary. They're a little less common with the hip joint, but definitely still important. Here's a picture. So one thing you'll notice is there are several pictures where they're using this big band, and the band is just helping stabilize the hips while you go through that mobilization. there's so much more musculature at the hip that mobilizing it takes a lot more force. So stabilizing and securing the hips can be important. Sometimes you just wrap this band around the hip that you want to mobilize, and then wrap the rest of the band around your body and use your body weight to mobilize the hip joint. Remembering our convex concave rule, okay, the femoral head is a convex surface on the acetabulum that is a concave surface. Okay, so because we're mobilizing the femur and the femoral head is a convex surface, the glide and the movement are going in opposite directions. Okay, so as he is gliding downward here, he's going to help increase an upward movement or hip flexion. Okay, so he's gliding down towards the feet, but he's helping improve knee flexion, or sorry, hip flexion here. Okay. In contrast to that in C here, he is doing a glide towards the front of the hip, which is going to help her to do hip extension, bringing that leg back up. Okay, and you can see he's got a towel under there to create some space so that he can still get movement in that glide. Okay. Another one for hip flexion. Now he's doing more of a downward glide, pushing that femur back, and that will again help improve that hip flexion as well. In picture D here, he's just stabilizing the pelvis and doing some internal-external rotation at the hip joint. This is more of a passive stretch than a joint mobilization. Okay. Here he's trying to improve some abduction. And then here is just an example of traction. So he's just pulling, trying to create some space in that hip joint between the femoral head and the acetabulum. He pulls, gives it traction, allows some space. That can help decrease inflammation and pain, as well as increase the range of motion. Okay, and he's got her stabilized with that band again. Okay, so after we work through that range of motion, flexibility phase, we move into strengthening. One thing that I like to note with the lower body is that we really have to take advantage of, one, the weight of the limb, and two, the body weight of the person. So when we're strengthening, there's a lot more time spent without using different weights or resistance bands and stuff like that. We can really utilize their limb weight and their body weight. So for example, when we think about doing some early hip strengthening exercises, take picture A here. Okay, we could just do active range of motion like this. Okay, actively lifting the leg, a straight leg raise, will help work hip flexion. And then she could just roll onto her side and do a straight leg raise and work hip abduction, roll onto her stomach, do hip extension, and roll onto her other side and do hip adduction. Okay, so all just utilizing the weight of the thigh and lower leg to strengthen the hip as you do those exercises. Then when you want to progress, you could put some sort of ankle weight or something on her lower leg, and then she can do those same exercises. And then when you want to move on past that, you can just move into body weight exercises, body weight squat, body weight lunge, stuff like that. Okay. So just, important to think of when you're thinking of progressive resistance exercise. Just use the weight of their limb against gravity, then work to body weight. Then you can start adding, different resistance bands and stuff like that. Okay. So active exercise should be pain-free. Uncomfortable is okay. And then whenever we do pelvis and hip, we also want to incorporate a lot of core exercises. Yeah.